Hi viewers, welcome back. In today's video, we are going to discuss about the nursing process. In nursing process, already we have started with assessment. We have read about assessment in detail. Now we will discuss about the diagnosis, the second step of the nursing process. Okay. So in diagnosis, what we have to remember? So, when we consider the nursing diagnosis part, this nursing diagnosis we always say it is Nanda nursing diagnosis. What is this Nanda? Nanda is the North American Nursing Diagnosis Association. So, according to this association, they have formulated a set of nursing diagnoses. So, these nursing diagnoses we take it into reference, and these are the diagnoses we are following in our daily practice. Okay. So, what is this Nanda nursing diagnosis comprises of? Okay. So, actually Nanda nursing diagnosis has three parts. Okay. So, we will discuss the parts in detail. It's a little later. So, first, what are the areas of nursing diagnosis? The first part is the actual nursing diagnosis, that is the present complaints of the patient. So, when we consider the Nanda diagnosis of the actual problem, that is your actual diagnosis. So, at present the patient is having breathing difficulty, the patient is having pain, the patient is having fever. So, all these comes under the present nursing diagnosis, that is actual diagnosis. Then comes the health promotion diagnosis. Health promotion diagnosis is like some aspects we have to improve, that is like when the patient is having anemia, we want to improve the HB level of the patient, that is your health promotion aspect. So, you will have diagnosis under this health promotion aspects. And then comes the risk nursing diagnosis, that is like you do some procedure, the patient is having some diseases, there is like some intervention is going on for the patient. So, at that time there are chances for injury, accidents, side effects, complications. So, all these things comes under risk diagnosis. Okay. So, the risk nursing diagnosis are also a part of the Nanda nursing diagnosis. Then we have syndrome diagnosis. Syndrome is not only a particular condition, you have a group of diseases or group of complaints. So, at that time it is called as syndrome diagnosis. So, usually your Nanda diagnosis is classified into 4 areas of actual diagnosis, the health promotion diagnosis, the risk nursing diagnosis and the syndrome diagnosis. So, we have 4 areas of diagnosis, that is in the Nanda diagnosis. Okay. So, now we have components of the nursing diagnosis. We have 3 components. So, one is the problem, then comes the etiology and the defining characters. Okay. So, whenever you have a nursing diagnosis, whenever you formulate a nursing diagnosis, the diagnosis must comprise of 3 areas. So, first is the problem. So, that is the existing problem of the patient, and then we have the etiology, that is the etiological, which is the cause of the problem, and then comes the defining characters. So, defining characters is the signs and symptoms of the problem. Okay. So, these 3 parts comprises of the nursing diagnosis. So, whenever you consider the nursing diagnosis, you have to remember 3 areas of problem, etiological factors, then the defining characters. Okay. So, these 3 will be present in all the Nanda nursing diagnosis. But when you come to the statement part, we have 3 areas of statement, that is your single, that is 1 part statement, 2 part statement and 3 part statement we have. Okay. So, what is 1 part statement? That is, in this 1 part statement you will have only health promotion aspects. Okay. So, that is you will have only factors that is to promote health. So, you will not have problem, you will not have etiology, and you will have only like regarding, like that you have to write. Okay. So, whenever you have a one problem statement, Okay, only one problem is there in when there is an nanda diagnosis. You will have statement as ready for, readiness for. So, readiness for delivery, readiness for health promotion, readiness for self care. All these factors will come for health promotion aspects. Okay, so you will not have problems, no. So at that time you cannot have the other parts. So only one will be there, that is your one part problem. Okay, one part statement, you have health promotion. So example, you have readiness for, you have to formulate like that. So whatever you are thinking, the aspects you want to give health education, so in that area you have to write as readiness for. Then comes the two-part statement. When you come for two-part statement, you have two areas. So one area is the problem. The first part of the statement is the problem. The second part of the statement is the etiology, and the third part of the statement is the, like you have only two, this is your two statements. So only two you will have. So one is problem and then comes the etiology. Okay, so whenever you have two-part statement, you will have example non-compliance related to. So only two factors you have. So you don't have the signs and symptoms. Okay, so only problem and the etiology. So now you consider non-compliance for drug intake, non-compliance for diabetic food care, non-compliance related to inadequate drug intake, non-compliance related to poor exercise. All those things can come. So you will have non-compliance, that is like you don't maintain the factors. Okay, so that is your non-compliance related to. So whenever you have your two problem statement, you have your problem and the etiology. Only two areas you will face. Okay, then coming to the three-part statement. So when you have nanda diagnosis with three parts, you have three areas. So one is the problem. So the first part of the statement or the diagnosis is the problem. The second part of the diagnosis is the etiology, and the third part of the diagnosis is the signs and symptoms. Okay, so now whenever you get a three part statement, you will have the first part, you will have characters like altered, ineffective, like that you will have. Okay, so those areas comes as altered. And then comes the problem. Problem is in which area? So it is the problem related to respiration. So your etiology comes from the area of respiration related to. So how do you say? The signs and symptoms, that is like breathlessness, secretions, like something, whatever is related. Okay, so injury, anything you can write. Okay, according to the need of the client. So you are able to understand these three areas. So one part statement, two part statement and three part statement. One part statement, you have only one factor, that is health promotion factor. You will be having readiness for. Your statement starts with readiness for. Then when you have two part statement, you have the problem and the etiology. Okay, so that is like your non-compliance related to what are the signs and symptoms. Okay, then third part statement, three part statement, when you have, you will have the problem, etiology and the signs and symptoms. So when you are getting statement three problems sentence, when you are diagnosing, you have to write first the problem, that is your altered, ineffective, all those type of things will come, and then comes the area, like that is the problem, that is etiology related to. So what you have to write? Breathing, like altered breathing, ineffective breathing, decreased perfusion, those terminologies will come. Okay, so then related to the signs and symptoms, okay, you have to write. So now you are able to understand what is this three areas of statement. When you want to formulate a nanda diagnosis, you have three steps in doing so. So the first step is the analyzing data. So when you want to analyze the data, so first you will collect the data. So first, in the assessment part, we have collected data. We have discussed the method of data collection, from the areas like from whom we will collect the data and what are the types of data we have to collect. So all those data we have collected, and we will analyze the data, whether it is true or false, whether we can like enter these data or not. That you have to do an analysis. And then the next step is identifying the health problems, risk or strengths. So this is like you have to identify the problems. That is like first you have to assess the actual diagnosis. So first comes, so whenever it is like we have seen these 4 areas, no? So the first 4 areas, whenever you are going to formulate a diagnosis, the first part is the actual diagnosis, the present diagnosis of the patient. That is like at present what complaints he is having. So that is like pain, breathlessness, tiredness, weakness, giddiness, all those things will come as your actual diagnosis. At present what diagnosis he is having at that. And then comes the health promotion diagnosis. So now imagine a patient is with the cardiovascular disease, okay. So the patient is complaining breathlessness. So first that will be your diagnosis. The second, so second diagnosis, what has to be there? It is your health promotion diagnosis. So what you have to talk about health promotion is your lifestyle modifications you have to talk about. So health promotion related to, so like that you have to formulate a diagnosis, okay. And then comes the risk nursing diagnosis, what the patient is prone for. That is risk for what? So the patient can go in for sudden arrest, okay. So that you can write, that is coming as your risk diagnosis. And then comes your syndrome diagnosis, that is together all the complications. So that is like maybe he is having a diabetes, hypertension, cardiovascular disease, everything together, okay. So that is like together you want to give a diagnosis for that, okay. So likewise you have to identify the health problem, the risk factors and the strength of the patient, how he can manage the condition, what type of diagnosis you have to formulate, that you have to do in the second area. And then coming to formulate the diagnostic statement. So you have to formulate the statement. First you have to decide whether it is a one part statement, 2 part statement or 3 part statement. Accordingly you have to formulate the statement, okay. So if it is a present diagnosis, you will have the all the 3 parts, that is the problem, etiology and the factors. Now imagine if the patient is having disorientation, the patient is disoriented coming into the hospital. So you want to formulate a nursing diagnosis. So what you will write? Imagine, okay, so think. So you can write a diagnosis as impaired sensorium related to what? The patient will not have any oriented behavior. So there is no orientation to time, place, date, all those things you can write, okay. So that is like one diagnosis you can formulate, that is your actual diagnosis, okay. Then comes the potential diagnosis. The next diagnosis will be, first you will list out all the actual diagnosis and then you will go to the potential diagnosis, and then comes the risk diagnosis. Finally the health education part, that is like education regarding, that is your readiness for, like that you will formulate. So all your actual problems will be 3 statement problem, like the 3 part problem, and then your risk problems will be 2, and your education part, that will be 1 part statement. I think I have made you clear about the nursing diagnosis, okay. Actually when you start your nursing process, it will be little difficult for you to handle, but when you keep on writing your nursing diagnosis, it will become easy, okay. First you have to remember the actual problem, the potential problems, the risk problems and the health education part you have to remember, okay. Hope you understood this nursing diagnosis, which is a part of the nursing process, okay. So next we will discuss about planning in the next class. Until then, take care. Bye.